The following segment is sponsored by Oklahoma CyberKnife. It's not a list to be number one on, but when it comes to the leading cause of death among men and women, lung cancer is still at the top. That's why understanding different treatments are so important. And one of those treatments can be found at Oklahoma CyberKnife. Joining us this morning is Dr. Diane Heaton, radiation oncologist and medical director at Oklahoma CyberKnife. Thank you so much for joining us this morning. I see you got the red memo. We're kind of matching this morning. So talk to me about different types of lung cancer and how you guys stage it in someone's body.
Yes, we typically stage by how it's spread and then how large it is. And for CyberKnife, for stereotactic body radiation, we're typically treating recurrent disease in stage 1 and stage 2.
And you had an interesting statistic about stage 1 lung cancer.
Yes, unfortunately, many people are told it's very small, it may be growing slow, so maybe we shouldn't treat it. But we find that at that point, your median survival is under a year, 11 months.
So talk to me a little bit about some of the risk factors that come with lung cancer.
Lung cancer is predominantly smoking still, secondhand smoke and primary smoke. There's other radon, other diseases, obviously asbestos and some of the mining can increase your risk of lung cancer, but predominantly smoking.
So we're seeing a few of the images and videos of it now, but the technology that you guys use at CyberKnife, non-invasive, correct?
Yes, so this is perfect for someone who has very poor lung function. Surgery would be quite risky, and we're able to treat them with 3 to 5 days and with very little downtime. And they literally come in, get treatment, and leave and go to dinner.
So explain to me how this technology works, because we're seeing a video of it right now. Is it lasers? What is it?
It's actually small beam radiation. And then one of the fascinating things is we can use this robot to break the beams up. So the beams coming into the body are under 1%, and then they converge to where we need to. So we minimize any damage to the rest of the body.
How amazing is that, that it's non-invasive? Because when you have those invasive surgeries, it takes so long to recover.
It does. And now there's obviously a role for surgery, and I wouldn't want, both are very important, but this is an excellent procedure.
So what are some of the short-term and long-term benefits of CyberKnife?
So it nearly doubles the rate of survival, and patients do extremely well. We only lose about 5 or 6% of the lungs.
That's really low.
Very low. So patients who have very poor lung function, already on oxygen, we're able to treat, and they don't go untreated. And then, they do extraordinarily well, prevents it from growing and from possibly spreading.
So if people want more information, they think, hey, maybe this is something I want to check into, how can they do that?
They can call us. Our number should be available, and we're more than happy if they just want to call and ask a question. I'm more than happy to answer any questions.
Well, thank you so much this morning. Appreciate your time.
Thank you.
Oklahoma CyberKnife, that's 6802 South Olympia Avenue. They're in Suite G100, 71st Street and Highway 75. There's the number that Dr. Heaton was just talking about, 918-949-6676. You can also go to oklahomacyberknife.com.